Hey, Dr. Tracy, board certified general pediatrician, and I wanted to talk quickly, if I can, we'll see if I can do it quickly, about medical trauma. I see medical trauma as when the medical system itself has caused you harm or perceived harm or not listened to you, not taken care of you in your time of need. And I truly believe this is the main reason for the movement that we have right now, where there is extreme anger and aggression and distrust of the Western medical community. And so I wanted to kind of quickly address that and talk about how important that is to myself and most of my colleagues, that we don't contribute to that problem. So I myself, also have medical trauma. My husband had a routine virus and ended up getting a heart infection that he was not listened to over and over and over again because he was young, and they said it was anxiety and were blowing him off, and he nearly died. And there were several times during this situation that had I not been a doctor, had he not been a doctor, if we didn't have people on our side, I truly believe that he might not have made it. And I felt like I had to have a handle on every little aspect of his medical care so that something terrible didn't happen to him. And so I tell you this story with his permission, of course, because I really do understand. And I think most of us who are on here because the only voices were voices that were kind of in the opposition. And we wanted you to see our faces and see our hearts and see how much we care and how much we are trying to also change that stigma, and how much there are a lot of us who are out there who recognize that the system is broken and that the way that we do things, we don't like it either. Just so you know, I don't like that I had to see, over 20 patients today. I don't like that I don't have the time with families that I want to. I don't like that I have to do prior authorizations, and that there's a disconnect when I send someone to a specialist and I know something odd is going on, and you've got to bounce between different people and nobody's talking and nobody can just get together and figure out what's happening. I don't like that. And I totally understand that. So please know that there are a lot of us in the medical community who completely understand how you feel, and we don't like the system either. We want it to change. We might disagree on whether or not an experience that you're having is related to what you think it is. We might disagree, right? But we need to be better at communicating. We need to be better at making patients feel heard. And so if you take away anything from this, please know there are a lot of us out there that are trying to do better and that want to do better and don't want to contribute to this issue. And so I hope that maybe somebody listens to this, sees this as something that's not aggressive. I've definitely put some posts on here that are a little bit more pointed about things, and I've been quite brutally attacked, to be honest, and that's fine. I wouldn't have put myself out there if I didn't think that would be the case. But I also want people to understand that I do see those comments and those attacks for what they are, which is pain. And so I want really badly to try to be on this space, a place where maybe you could get medical information that you don't feel comfortable getting someplace else from someone who does not want to contribute to your pain. So I hope this makes sense. I hope it comes across the way that I intend it to. But please know there are a lot of us out there. Don't give up. We can work together. We can make sure that we don't bring back horrible preventable illnesses and destroy our children's future, but also do so much better than we've been doing. And so please take care, and hopefully we'll talk soon.